I'm going to go through the state requirements. I think Gabby forwarded you all the 7-page document. I'm actually grateful that the state got this out so early, so at least we all know what we have to plan around. And then, so that'll be a few of the slides, and then Trisha is our public health nurse, and she'll go through sort of how she hopes to be able to interact with either the camp nurse or the camp director if you have positive cases and suspect cases. So I'm now going to try to share my screen. Okay, are people seeing this?
Yep. Yes.
Okay. Oopsie daisy. Okay, so I'm going to quickly go through the state health and safety standards that they issued, I think, last week. Staffing and operations, visitors, including parents, are not permitted. And if people have questions, jump in, because I don't want to just talk at you. We've already gotten questions about, for the campuses that host other activities, such as Drumlin Farm, where the public is allowed on the campus while camp is running, is that going to be allowable? We're sending that to the state and trying to get an answer to that. But as it stands now, visitors, including parents, are not permitted while camp is operating. The camp must designate a senior staff person who's responsible for responding to COVID-19 concerns. So that's the person that really has to be up to speed on it and all the requirements. Everybody this year has to have at least 2 healthcare supervisors present at all times. They don't have to be nurses, but they do have to meet the definition of healthcare supervisor in the camp code. You're going to have to update your operating plans to address the health and safety requirements with COVID-19 and include those plans into staff training and orientation. And we're going to require that you provide us documentation that all of your staff have been trained in these new protocols. Staffing and operations, you need to have a tested communication system with parents, children, staff, facilities, and EMS. You know, obviously, if you have a symptomatic person in the camp, you need to have a flawless communication system to be able to get a hold of parents and anybody who's going to come disinfect your facility, and with EMS should there be a medical emergency, which we certainly hope there won't be. So you've got to have your parents' email and homework and mobile phones so that you can get a hold of parents right away. If you have a suspect case or someone who's symptomatic, you're going to have to, you know, you're obviously going to want to isolate them, but you don't want them hanging around for hours until you can get a hold of parents and get the kid picked up. This one gets a little tricky. You have to have a plan for screening children and staff that includes daily screening checks with designated staff. The staff conducting the screenings have to be trained by the camp's healthcare consultant, and we're going to require documentation of that. And the daily screening must include visual inspection of each camper for signs of illness. I know the schools have been using some piece of software that parents can kind of, you know, check off, no, I don't have the following symptoms today, and submit that. I think if you have access to that software or something similar, you know, you're welcome to use it, but clearly you have to have a visual inspection of each camper every day. You know, so it's going to have to be, you're going to have to, well, you don't have to, but you could develop some kind of hybrid. But there is going to be a visual inspection component.
Susan, can I just ask a real quick question? Do you have any specifics on what that visual inspection has to include? Does it need a temperature check? Is it?
I'm going to turn that over to Tricia McGean, who's our public health nurse.
So you do not have to take temperatures upon entrance to camp. You guys can. It is one data point. A visual inspection is honestly, you guys, what I'm seeing for the last year, and most recently, kids that are testing positive have cold-like symptoms, the runny nose, watery eyes, you know, a bit of a cough, headache. It is not the fevers that we had last spring. So if you have a you know, non-touch thermometer, you can absolutely do that as one data point, but it doesn't make or break entrance.
Little eyes down.
Yeah.
And so at drop-off, parents must verbally confirm that their child and anyone in the household does not have COVID symptoms. So you're going to have to, interview the parents. And they have to sign a written attestation regarding any household contacts to someone with COVID-19, or if they've given their child fever-reducing medication. And you have to keep records of these health check responses and maintain them on file. So you've got to figure out what your system for that is going to be.
So is this the, just quick question, is this the hybrid system then? So the grown-up is attesting on the app that we use at school. They're signing a written attestation regarding the contacts, regarding symptoms and the fever reducing medication. And we can record that through the app. The verbal confirmation, sometimes it's a 17-year-old older brother dropping off a kid. So they don't have any, we can't, ask a nanny to attest if the grown-up has given any fever reducing medication. So would that be the hybrid that you were talking about, where like an app would serve as this written attestation and then the visual would be on campus?
If you can come up with that hybrid, I think that's a great idea.
Okay.
I mean, I understand that, people other than parents drop kids off at camp, and you're right,
Yeah.
they attest. So I think if you can get a software app that will do what you need it to do, that would be great. But the state is clear, at drop off, you must interact with parents or whoever's dropping off and verbally confirm as much as you can.
Okay, great. Thank you.
And whoever's dropping off should be instructed to be ready to answer these questions. Okay, isolation and quarantine. Symptomatic individuals. You have to have procedures for immediately isolating symptomatic individuals, notifying the parents immediately, and mitigating transmission until the sick individual can leave the premises. You've got to have a separate space to isolate them. You have to notify us immediately if you have someone symptomatic. And then the state is saying if a symptomatic individual tests negative, they may return to camp after symptoms improve and they have been without fever for 24 hours without use of fever-reducing medications. And as we get into the sort of more nurse-specific interactions, I'll talk about, if you want to have them quarantined for more than, for an additional period of time, in addition to testing negative, you can do that. But at a minimum, symptomatic individuals must be tested negative before they can come back. Whoopsie daisy, where were we? Yeah, okay.
Does it matter if that's a rapid test versus PCR?
Tricia, I think what do you think? I think it should be a PCR test. What do you think?
I mean, I know the Binex now is very accurate, but antigen tests are we always ask that they get a follow-up PCR. So if I were all of you, I think we should stick with the PCR and just keep it simple instead of making kids get 2 tests. They come back pretty quickly these days.
Yeah.
That being said, if you guys have a Binex now on your campus, and I know some schools do, private schools, we can talk about this. But PCR is the golden test.
Because you don't want somebody to do an antigen test and then really be positive and come back to camp, because that's just going to be a bad scenario for everybody.
It gives you a quick question. It gives you a quick answer, but is it confirmatory? It's not a confirmatory test. If I get a positive antigen in that DPH website, it's a probable case. It's not counted to, Concord's 492 cases. Not that that makes any difference, but it's not a confirmatory test.
Okay, so then positive cases and close contacts may not return to camp until they meet the requirements for discontinuation of isolation or quarantine. It's going to be the responsibility of the camp nurse or health supervisor or camp director to ensure that occurs. The state wants to be notified as soon as possible and no later than 48 hours after notification of a positive case, and you use the camp injury and reporting form. And then you have to work with us to identify and notify close contacts, which we'll get into in a moment. Okay, so this is the Concord Health Division protocol, and I'm going to let Tricia talk about a lot of this. This is pretty much what we've been doing with the school nurses all year. So Tricia, you wanna kind of take over here and talk through this and answer people's questions?
Sure. Yeah. And so again, for all of you, I know some of you are already in the school system and have been doing this for people that have not done the contact tracing or had any experience with it. I will make sure that I meet with everyone once you get your camp nurses and everyone, all the staff hired. We will go through this. I'm going to work with you guys together. I'm a really well-greased machine. I'm quite fun to work with. So don't stress. We'll get through it together. The important thing is you've got to let me know. As Susan said, I cover Lincoln, Concord, and Carlisle, and also Maynard. So if you have any positive staff or kids that live in those towns, I will get the results. I'll get negative and positive. If you have a kid from Acton, I won't get that information. So what's important is that you guys let me know that, hey, Joe Brown, I just sent him home with a fever. He just tested COVID positive. And then I will work with the Acton Public Health Department to figure out the isolation and the isolation period. So for a positive case, it's 10. And I know I'm not looking at Susan's slides right now, but
Yeah, I'm gonna go to the positive case slide.
okay, sorry. For a positive case, all right, I'm gonna follow your cues. The camp nurse or director has to notify the Concord Health Division and myself immediately. And again, I will see it in Maven in the state website, but it's sometimes a day or two delay. So often the kids and or the adults are going to find out before I will find out. As soon as we find out, it's really important that you guys let me know so we can begin the contact tracing, we have to look at who was within 6 feet for 15 minutes or more cumulatively. 48 hours prior to onset of symptoms or positive test date. So if someone was tested positive on a Friday, we're going to look who were they hanging out with within that from Wednesday on, staff and kids. All right, camp nurse must provide information about, those days, the 48 hours prior, last date the person attended camp, contact information, name, date of birth. And again, we will go through that all in an email. Yes, Maggie. Maggie's raising her hand or giving me a high five. But she's on mute. There she is.
Sorry, I'm here. So my question was where it says the camp nurse or the camp director. We are considering having like a nurse admin just because our school nurse has recommended that we have more than one person available to manage contact tracing. So I'm assuming it could be a different person besides the nurse or the admin the nurse or myself that contacts you. Is that true?
Oh yeah, I just need the information. Yeah.
Great, thanks.
I think our preference is to for Tricia only to have to work with one person. We don't really care who that person is as long as the person is knowledgeable and competent. And then Tricia can tell that person all the information that she needs that person to gather and what else needs to be done.
Great, thanks.
And obviously for the kids, we need an adult to attest to who was in their cohort, and often the whole cohort will be close contacts because one, it's easier, but two, obviously, if you all decide, and what that'll come in the next couple of slides about how long the quarantine period for close contacts is going to be at your camp, the whole cohort may go out. So if I'm going to tell you anything, the most important thing other than mask wearing is distancing. So whenever possible to keep that 6 feet of distance, that is going to make or break a close contact. All right. So as we've said before, for campers and staff who reside in other towns, it's critical that the camp nurse informs me of that case so I can reach out to the nurse in that town. We'll work closely together, say with the Acton public health nurse to ensure that cases followed as appropriate. So the Acton, so say it's the Acton child, the nurse in that town will receive the lab results and has to do all the administrative part of the case, linking the contacts, but I need to give Acton who those kids' names are from you guys. You're the ones that have to give it to me. There are multiple cases at the camp. This also allows public health authorities to create a cluster in Maven. So all associated cases are tracked to the camp regardless of the camp or staff members' town of residence. So
Remember that positive cases are tracked by the public health authorities in the town that they reside in. So because all of you or many of you may be bringing together campers from many towns, it gets a little complicated because the positive case is going to be tracked in the town they live in. If it's Concord or Carlisle or Lincoln, it will be Tricia taking care of them. But if it's another town, it will be another public health nurse. So you've got to be ready to work with that public health nurse if it's not Tricia. And then the contacts can live in multiple towns. So it gets a little tricky.
Prepared to work. Okay, all campers and staff within a cohort will generally be considered close contacts unless there's a clear reason why this would not be the case. The camp nurse will investigate who else at camp may be a close contact, other staff members, a coach, lifeguard, driver. So it's not just the cohorted group. You have to think about, was there any mixing, a private lesson, they carpooled with another family. Well, if there are any buses, that comes into play as well. Camp nurse will also provide a list of close contacts to me. Okay, next slide. Upon notification of the positive case, myself or another public health nurse will enter the close contact information into Maven. Camp nurse will do outreach to all parents of campers who are close contacts and staff and others who are close contacts. I have a template from the state that I will give to you guys that basically is a bunch of resources and also says there's been a case identified at camp. Your child has been identified as a close contact or your child has not. I think it's very nice to have a phone call, not just send them a blank template email if they are close contacts, because that requires immediate quarantine testing 5 days after their last exposure to that case. So Susan, I'm not sure what slide we're going to talk about unless I missed it, about the camps deciding what quarantine period to follow.
That's the next slide. But so let's just talk about the sort of positive case and the close contact case. So let's say a kid shows up to camp on Wednesday morning, or let's say you get a positive result on a Wednesday morning. You immediately notify Tricia and you immediately start figuring out who the close contacts are. But then you need to start contacting those parents as quickly as possible. The schools have kind of been doing it by an email first. Hi, your child, we have a positive case in your child's cohort. Your child now has to be quarantined and the camp nurse or someone will call you later on today to follow up. But, you want to let the parents of the close contacts know as quickly as possible that they should not be sending their kid to camp that day or the next day, or if the kids are already at camp, when you get the positive case notification that they're going to have to come pick up their kids immediately and take them home and get them quarantined. So I guess what I'm trying to say is you really need to think about what that protocol is going to be, as well as notifying Tricia and working with Tricia. You have to sort of have your parent outreach plan in place to get to parents and get kids quarantined quickly.
And when it happens, it's somewhat time sensitive and stressful. So to get it done ahead of time and have those protocols and have that template email ready to go. So then you can, follow up with phone calls is a really good idea.
And then the other thing to think about is which quarantine protocol are you going to use before you let quarantined kids come back to camp? It can be the 7, the 10, or the 14-day protocol. You want to go through them, Tricia?
Sure. So they changed this, I think, in November, December. So the 7-day protocol, if you guys click on the link, and you can look on the DPH website as well, so this is 7 days from their last exposure to the positive case. The last day of exposure is day 0, and you count through day 7, and they can exit on day 8 as long as they test negative on or after day 5. So if you're exposed on a Friday, most parents will take their kids to get tested Saturday because they're afraid, but nothing's going to show up yet. What we're seeing is day 5 is a really good time where we're seeing people either become symptomatic or flip over to positive. So they must wait until they can test beforehand. And, thankfully it's not that traumatic for kids anymore. With the testing is very superficial as far as their nose is concerned. So that's the 7-day. The Carlisle school is doing a 7-day quarantine. 10-day quarantine, Concord is doing that. So that is 10 days after their last exposure, testing on day 5. Now, that being said, someone's going to say the state says you don't have to test if you do a strict 10 days. And why they changed this, it used to be a straight 14, found out that one, we really are seeing that magic day 5, 6, 7, the flipping over, and people weren't really strictly quarantining. So even though we go to the 7 or 10 days, it's really important that you still have to monitor for symptoms for really the full 14 days. And if there's any change and you're become symptomatic, and you're not at day 5, you're on day 3, you go right out on day 3 and get tested. Day 14 is a 2-week quarantine period. Lincoln, right, Joe, I think you're on this. Lincoln is at 14 days. Concord does 10, Carlisle does 7, Lincoln, Sudbury does 7. So you have to kind of decide which is most comfortable for you. Most of the private schools and public in Concord are 10. So that's gonna have to be written in your COVID plan.
Right. The sort of the beauty of using the 10-day is it's more straightforward. If you use the 7-day, then you've got to track like what day is day 5 for the kid to get tested. They can't be tested before day 5. They can be tested after day 5. So it's just a lot more record keeping for whoever is going to be enforcing the quarantine protocols. I think the 10-day is just easier. You figure out what the last day of exposure was, and you wait 10 days and the kid can come back on day 11. But if you want to use the 7-day protocol, you can. You just have to decide what you're going to use and let us know.
Something else. So say you have 2 kids, Jack and Jill. Jack was a close contact at camp. He was notified. Jack has to be home for 10 days. So Jill also goes to the camp, and Jill is Jack's sister. What we're doing is keeping siblings home until we get Jack's negative test on day 5. And you guys can decide whether or not you want to follow that sibling plan. And what I'm telling you from the last year of doing contact tracing for these 4 towns is once it's in a household, it's going to go right through the household. So it's a good way to prevent transmission and spread. And your decision, I guess, has to be in your COVID safety plan that you're going to show us.
So you are not required to keep the siblings out of camp. I mean, you're only required for the close contact child to be quarantined. You're not required to keep the siblings out. But as Tricia says, if one person in a household gets it, pretty much everybody else gets it. And we've found it to be very effective in the schools the schools made a decision early on that siblings would be quarantined too. And we think it's prevented a lot of community spread within the schools. So it's up to you what you want to do. But we think it's a good thing to keep the siblings out until you get till you know that the close contact is negative.
Right. Once they're negative on day 5, the sibling can go back, but the negative person still has to complete their quarantine. A negative test does not get you out of quarantine. And we had a bit of a whoopsie this weekend from a family that thought, okay, I'm negative and I'm out, and that it didn't. Yeah, it was a bad situation. So that does not get you out of quarantine. If the close contact becomes symptomatic, definitely that's a time when siblings should stay home, because if the close contact does become symptomatic, then we're pretty sure they're going to probably test positive. And I'll tell you, for the last month, definitely seeing a decrease in cases, except the last 2 weeks when I also do Maynard, getting 15 cases like about a month ago. Then it got down to 1 or 2 between the 4 towns. I'm like, wow, this is great. Going right back up. I had 4 K-12 kids this weekend, and it's the young kids. It's 5 to 17. So that's a little bit concerning. So, and it's families. It's starting with the 40 to 50-year-old parents going right through the kids. So it's still here. I know we're done with COVID. COVID is not done with us, but we're going to get through it together. It's going to be a fun summer. We have to be safe. We have to protect our kids, protect our staff. And we're going to have more meetings like this. And I'm happy to meet one-on-one with the nurses or any camp that would like to meet with me.
So I'd like to re-emphasize what Tricia just said. I think everybody is ready to get on with their lives. We're all over this. People, and it's going to be summer. It's going to be nice. People are going to be socializing. You have to think about, you may be running a really safe camp, but you don't know what those kids are doing outside of camp, who they're socializing with, where they're going. Are they traveling on the weekends with their parents? Like, it's out of your control. You've got to assume you're going to have cases. It looks like the case numbers have been coming down very nicely recently, and all of a sudden we just think people are over it. They're not taking the safety precautions seriously anymore. Everybody seems to think we're working our way out of this. And I think that we are, but not as quickly as we'd like to be. I think you have to assume you're going to have positive cases, because we're not out of this by any means. And Tricia, once you get your camp nurses hired, Tricia will do another Zoom call, and Tricia can really work through the protocols one by one. And then if the first time you have a case, it's usually pretty upsetting to people. It's upsetting. Well, maybe parents are used to it now. I don't know, but it's upsetting for staff. It feels like a crisis. Tricia will be there for you to help you kind of work through the first time, but with an expectation that your camp nurse and camp director are going to be able to kind of carry the ball after that. But we will do a training when the camp nurses get hired. So we'll put all this stuff on the webpage. It isn't up yet. All the guidance documents, the quarantine documents will all go up on the camp webpage. Here's the link to the Massachusetts webpage and the COVID safety requirements for various sectors and activities, and the recreational camp for children webpage. And for those of you that have never done contact tracing, Johns Hopkins runs a 7-hour free online course on contact tracing. For those of you who are new to this, I would say it's well worth having your camp director and your camp nurse take it. It'll give you like the conceptual background of how contact tracing works, so that if you have to do it, you'll have the whole sort of fundamentals of how it all works in your head. So.
Susan, are the slides going to be available also on the website, or will you email them to attendees?
I'm going to put them on the website, and this Zoom call is being recorded, and the link to that will be on the website too.
Thank you.
Yeah. And we have had a number of questions, which we don't have answers to all of them. Some people have submitted them in writing. We're going to submit them to DPH and get answers. So I will be posting an FAQ document with all of your questions and answers, and we'll update that routinely. So as you start to plan and you have questions, email them to us, and we will get answers for you. see. Anybody have questions? Anybody need to say anything?
Tricia, I'm wondering if you all can just go back for a moment to the symptomatic piece. It seemed like we kind of went from the symptomatic into the positive COVID case. And just give us a little bit more of an idea of, if we have a symptomatic camper, what were the specifics of them coming back and quarantining?
Okay, so if you have a symptomatic case, you need to call the parent and have that parent pick child up immediately, right? The child, if there are any COVID-like symptoms, and again, COVID-like symptoms are just about every symptom of illness right now, not related to a chronic illness like an asthma, like is a cough, is that asthma or whatever. But that has to be, the PCP for that child has to make that decision whether or not testing is warranted for the situation, or nope, this child always presents this way. This is not a symptom of illness. This is a chronic illness, or this is strep. And, there are other things out there besides COVID. I think right now people just think it's COVID or it's nothing, and that's not true. It's not your decision. It's not my decision. It's the child's pediatrician. And I think, Susan, it isn't the PCP, the camp can decide whether or not they want written or verbal confirmation from the primary care doctor.
Well, I mean, so this slide is a little confusing. The state guidance says you have to have if a kid is symptomatic, you have to have a negative test before you can readmit them to camp. I mean, if the PCP says this kid has seasonal allergies and their nose runs all summer, and I don't think they need to be tested, are you going to take the PCP's word for that? You certainly, I would say you can, but I would also say you're not wrong to require a negative test before you let the kid back into camp.
Right.
I mean, the state wants anyone who's symptomatic to be tested. So I would err on that side unless there's a clear reason from the primary care provider that a test is not needed based on what he knows about that child. Right. He or she knows about that child.
And I'm guessing at this point, most kids have been tested several times over the last year. It's pretty easy nowadays. So if I were you guys, for peace of mind, but again, a negative test on a Friday does not mean that the kid's not going to be positive on Saturday, right? It's a data point for that period in time. However, it's a data point. So, and then we don't want anyone coming back to school, to camp with any symptom of illness, right? At least 24 hours without a fever.
Trish, question about vaccinated individuals. Is there any updated guidance on how quarantine affects those who are vaccinated versus unvaccinated?
Yep. So if you're fully vaccinated, that means 2 Pfizer, 2 Moderna, or 1 Johnson & Johnson, 14 days post that second vaccination, you do not need to quarantine if you are identified as a close contact.
And do you think our staff would qualify under childcare workers once they are hired?
Regarding what, Joe? What do you mean?
Like once we hire, someone and get a contract in their hand, would they qualify as a childcare worker as far as the state is concerned to receive their vaccination?
Oh,
You don't think so, Trish?
no, I don't know. Yeah, I would think so, but
I would think so.
yeah.
I mean,
There was something on the website that specifically said camp counselors are not under the current group, but if that's going to change, that would be awesome.
well, I think, when you sign up on the website, it's a self-attestation form. I don't have any problem with someone attesting that they're a child care worker if they're going to be working at a camp. I mean, the idea is to get people vaccinated.
What else, guys?
Just to make sure that I got that with what question that Joe asked about. So if a staff member is fully vaccinated and they're a close contact of a camper that is positive case, they would not need to quarantine they have no symptoms.
That's correct. It's also important to note that that is absolutely right. So you do not need to quarantine if you're identified as a close contact. However, if you become symptomatic, you should test. These vaccines are not 100%. I've seen 1 or 2 cases of testing positive after full vaccination. So just be aware of that. We all know that it's not 100%. If you're symptomatic, still should test, but you get the quarantine by.
How about, I have a question about the test itself. Is there a place where we should be recommending people get PCR tests, or is that through primary care physicians?
Yeah, I start with the primary care physician. I mean, we can give you guys a list of, or anyone can look online where you can get tested anywhere from CVS and Wayland to PCP.
I think Emerson Hospital is still running their Baker Ave testing site.
Yeah.
And for a while, there were delays getting results back. I don't know how that is anymore, but Emerson is doing some of it in their own lab and sending some of it to the Broad. So they're pretty reliably getting answers back in 48 hours. And AFC Urgent Care in Bedford, you get the results that afternoon. You have to make an appointment online. Sometimes it takes you a couple days to get an appointment, but you do get the results that afternoon.
Right, and that's a really popular test at AFC Urgent Care in Bedford, you guys. It's called an ID Now. You get the results in 2 hours. As Susan said, it's a molecular test and it's PCR-like. So it's not a PCR test, but it is a confirmatory test. So if you want an answer that day, don't get an antigen test. Seek out the ID Now, it's called, AFC in Bedford. They have been very popular.
And if people are willing to drive, I just know that there is one in Worcester and there is one in Saugus, I believe.
For what, Maggie?
For the AFC, that same sort of rapid PCR-like test. There are a couple of other locations that will do it, and you typically will have your results even in a half hour sometimes.
Yeah. So what you don't want is to ask them to get, what happens is people get really anxious. So they'll go to AFC and say, do you want your results today, or do you want to wait 3 to 4 days? Well, of course you want it today. You just want to make sure you're not getting an antigen test. Then the parent comes back and say, look, it's negative. And then you guys send it to me. I'm like, nope, we need a PCR. So I think I just want to make a statement that all testing should be PCR or molecular tests like that ID Now. No antigen tests. Are you with me, Susan?
Yeah, I'm with you on that. I just think the antigen tests they're just not as good as the PCR tests.
But if that changes, and I know that they have a high level of confidence in the Binax Now Abbott antigen tests, we'll let you guys know, but encourage the PCR test. And also, if you have kids with Atrius Health, that's the old Concord Hillside pediatricians over there. They do their own testing. They don't want to send you out. So start with the PCP first.
I have a quick question. It's unrelated to specifics of COVID protocol. It's more on more on the PPE requirements for our staff. So we're at the point where we're starting to look into what equipment we're going to need. And the question is, what's the recommendation on, should we have every single staff member wearing gloves if they're doing any interactions, or should it only be the camp nurse, or when any first aid, any medical protocols are in place?
I think all staff should be masked. Gloves give people a false sense of security. So I do not wear gloves unless you're dealing with bodily fluids. Camp nurse, absolutely. If someone's vomiting, a gown, great. Regular staff, mask and wash your hands, and then make sure you're washing your hands. That's the best thing you can do. And we can talk specifics about PPE, but you guys are not doing surgery. We don't like bodily fluids, but everything else should be masked and hand washing.
Perfect, thank you.
I don't know if you all discussed this earlier, but I was wondering if you all had any really specific guidance around bathroom usage. I know I saw the information about the communal spaces and making sure that camp groups aren't overlapping in communal spaces, but just curious about, does each camp group need their own bathroom? Can they share a bathroom if there's full cleaning done between? Any other stuff on that?
Yeah, I think we're going to ask DPH for guidance on that one. It's a good question, and I don't know the answer.
Either.
And Megan, for Drumlin, Concord Rec, Camp Thoreau, all of the places that have multi-use, the public is in the space. I've got a email out to the state whether that's allowed at all, because they've clearly said no visitors, even parents. So I'm assuming that that means that any space that is a camp must be exclusive to the camp. But we're waiting on an answer from them.
Right.
Great, thank
It's
you
kind
both.
of already in the camp code anyway, that the camp
is.
has to have exclusive use of the space. But now the state in the COVID guidance is saying no visitors at all, so we will get some clarification on that.
I guess the other thing I would love a little clarification on is if, you folks probably have more pull than we do, but just kind of wondering why the guidance, especially given that we're outdoors most of the time, is more restrictive on the spacing than the school guidance, which is 3 to 6 feet. And yet the camp guidance seems to be 6 feet all the time. And so I guess I'm just wondering if there's any insight as to why that is, or if that's something that is likely to be changed or could be brought up with DPH, because that seems a little inconsistent.
Well, I will weigh in on it with what I know, which is that we know 6 feet works. Bringing kids back to school at 3 feet, if we thought that worked, we would have said that that was fine last summer. I mean, there's political pressure to get kids back in school, which I understand. But the reality is we know 6 feet works, and we're a lot less confident that 3 feet is will prevent spread of cases. So I think the state is viewing it as 6 feet is the correct guidance, and that's what camps have to comply with. Because camp is a voluntary activity, unlike school. So
Great.
I don't think the state's going to change it.
Okay, great. Thanks so much.
I just wanted to confirm, and I'm going to assume the answer is no, but no visitors is the same as no outside vendors, correct? Or we should not be having outside vendors because those are visitors.
You should not be having outside vendors.
Right. That's what I thought.
One question, if you talk a little bit about, especially thinking kind of the outdoor camps, hand washing stations versus kind of hand sanitation. Do we need to have outdoor sinks at various places where it may be very challenging to do that, or is using hand sanitizer okay?
I mean, my own thought is, I'll let Tricia answer this too. My own thought is hand washing is always good. I mean, if kids' hands are covered with dirt and then you put alcohol sanitizer on them, are you really going to clean the kids? Does it really disinfect the kids' hands? I mean, I understand some situations are impossible to install sinks, but to the extent that you can have hand wash sinks and encourage kids to wash their hands, I think that's the most preferable option. What do you think, Trish?
However, so as a nurse a few years ago, I'm a home care nurse, so I go into people's homes, and it was always wash your hands before you get in the nursing bag, before you touch patients. And then it changed to, it's 2 minutes warm soapy water rubbing your hands. Like, who does that, right? Purell kills 99.9% of the germs. So it was kind of switched that nurses are going to be, unless visibly soiled, use Purell to wash hands. For kids, I'm a big proponent of Purell just for ease, knowing that kids don't wash their hands very, quote, well. So I like both. I totally understand what Susan's saying. Realistically, I think Purell is easier and kills 99.9% of the germs. That's my Purell plug.
One of the questions I had for the state, and I'm not sure if anyone saw the answer to this, whether you need to have written authorization from parents to use hand sanitizer.
Yeah, I remember that question from the fall.
Yeah.
Do remember that at the schools. Yes, that was a question in the schools in the fall.
That it was a medicine or.
Yeah, because under camp, you have to have written authorization for use.
Oh dear. How about we look into that?
I will.
Okay. We can do it together.
I can remember Lori Hunter in Concord Public Schools struggling with that question.
Yeah. And then I think we got the okay that it was okay to use. I'll try to find out.
But they're also under two different guidance
Yes.
regulations, so.
Right, part of it is the DESI regulations, which you guys do not fall under, but the schools did.
All right. What else, guys?
In this document, in the camp document, it also links to the pool document and athletics document. In pool document, it said that swimming lessons that require contact are permitted. I just want to make sure that is in agreement with everyone, and if you have any suggestions on that.
The way I read that, Greg, was that the kids still have to maintain 6 feet from each other, but that obviously if you're teaching a child how to swim, the swim instructor needs to be in close contact with the learning to swim camper. But that also means that the close contact situation in that scenario is exacerbated.
Right.
Meaning they will definitely be close contacts. Whereas if you can keep your kids 6 feet apart or your staff 6 feet apart, you may not have close contact situation. Is that your understanding, Susan?
I think so. We'll try to write up send us your question in writing and we'll put it in the FAQ document.
So yeah, Gabby, that makes sense to me. You're saying that basically you're exposing yourself to more contact tracing.
Correct.
Potentially, but that kind of close contact for the swim instructor for safety is maybe needed and maybe preferred, but that you do risk more of your contact tracing nightmare for that kind of close contact.
Correct.
Yes.
You know, it would be really great if the swim instructor was also a vaccinated person, but there's no assurance that that will happen. I mean, the bottom line is the kids should still be 6 feet away from each other. But obviously the swim instructor can't. In older groups, they can.
How does the nurse themselves get around not being in close contact and having to quarantine after sending a kid home with suspected symptoms?
They're considered essential personnel.
Right. If you read the state guidance on page 4, it says, in the event campers test positive for COVID-19 or is identified as a close contact, they may not return to the program until they've met the requirement for discontinuing isolation or quarantine. Camp healthcare consultants, healthcare supervisors, and healthcare staff may follow the current return to work guidance for healthcare workers, which means that they can come back as long as they're asymptomatic and watching themselves for symptoms, correct, Trish?
Yeah, and as long as it's ideal to quarantine, if no one else can provide the service, they gave us an example of it's the only snowplow driver and there's a snowstorm, like that person would be considered an essential worker because if he doesn't plow the streets, then people are going to, get into accidents. So it's ideal if an identified close contact can quarantine, but doesn't have to, as long as they wear appropriate PPE, AKA a mask, and monitor themselves for symptoms. We can talk about if that happens. Well, I'll help you guys get through that.
But this would only relate to nursing, like healthcare staff, not essential archery instructor. There's no essential other instructors.
No,
Correct.
it's just camp healthcare consultants, healthcare supervisors, and healthcare staff.
Right.
So
if you don't have a substitute nurse and you couldn't run camp without screening all those kids the next day, she is essential, she's asymptomatic, or he can come to camp. And then go right home. That does not mean that you don't have to quarantine and you can go out for dinner and whatever. You provide your essential service and you go home. And again, if that happens, you guys, I will help you with that protocol.
right, those people are quarantined. That's a thing we've run into. Oh, I'm essential worker. I don't have to quarantine when I'm a close contact. You can go to work, but in your personal life outside of work, you're still quarantined.
Right.
Anybody else? Anything else?
I'm wondering about staff being assigned to one cohort unless they are supervising a specialized activity. Do you have a sense of what constitutes a specialized activity?
Yep, it's written right in the camp code, but basically, if you were a, let's say a high ropes instructor,
Okay.
you were a lifeguard, things like that.
Okay. Thank you.
I'm not sure if they consider, the arts instructor. I don't know, Maggie or Greg, I don't know if you've heard anything through ACA on this.
So far, we've heard that if it is somebody with a high level of skill that you can't get from your general counselors, and that's what's expected of your program, then that's a specialized instructor. So if it's somebody who, if it's somebody who has an expertise in a certain area, whether that's woodworking or performing arts or, whatever, then that would be considered a specialized instructor. I think that's my recollection, but Greg, you can weigh in.
Yeah, I would say that that's what ACA has said.
Okay. Yeah, I'm going to ask the state as well, but because that can get pretty broad reaching for both of your camps.
I mean, I'm kind of seeing it as you've got a cohort of kids and you're going to rotate that cohort through a bunch of activities like archery or ropes or some art activity. I mean, we don't want staff circulating between cohorts, but some camps are set up so that cohorts go from activity to activity to activity. And I think that, you have to have staff for those specialized activities. So though, if you have a positive case, the instructor in that specialized activity is going to be viewed as a close contact because they've come in contact with the cohort that has the positive case.
So that's a programming decision, whether you want to potentially take out specialized instructors.
Right.
Exactly. And I think that's what we've been considering is like, what can our regular counselors do? And what programmatic leaders might they be able to substitute for and which ones can't they? And that is sort of the contact tracing decision.
Right.
And I would think on some of those, though, you know, you mentioned woodworking or art, that they may be able to always maintain 6+ feet of distance, right?
Right, you could say, you know, my specialized instructor is going to be 10 feet away from any of these cohort groups, and their individual instructors will be the ones closer to them that
Right.
would go out. I mean, you can formulate it that way. But obviously, things like lifeguards and high ropes course, whether you're even going to attempt to do something like that, are hands-on. You can't check somebody's safety gear 10 feet away from them.
Thank you.
I guess my question then would be, just as I'm thinking about the 15 minutes of cumulative time, if there is intermittent contact between an instructor, that doesn't necessarily make them a close contact, but it heightens the risk, correct?
Correct.
Correct.
So with the kids in the cohort, usually the whole cohort is considered close contacts. But if that instructor did not, you know, we try to keep as much privacy related to the case as necessary, but often we have to say it was Mary Smith. It's like, oh, she was in the back. I wasn't close to her. I mean, sometimes we do have to dip a little deep into something that feels uncomfortable, but it's appropriate to not just say, all right, all 6 special instructors and the cohorts are going home for 10 days.
And
Got it.
remember, it's a cumulative 15 minutes over the course of the day. So if you're with,
Right.
if an instructor's with somebody within 6 feet for 5 minutes now and 5 minutes and, you know, a half an hour from now and another 5 minutes later on, that's a cumulative 15 minutes.
Yeah, I'm just thinking of like, if they're at an activity for a 40-minute block and, you know, they have intermittent contact for 5 minutes, they're not going to see that group again for the rest of the day, right? They're just having that one time. So I'm just trying to think about the risk benefit for, you know, something like that
Right.
for those activities.
So the definition, Trish, is 24 hours, which could be over the span of 2 days.
Yeah, 9 a.m. to 9 a.m., right? But
Well,
usually
no,
just
I'm saying like if you had a 3 p.m. group on Monday, and then that same
That group had it at 9
at
a.m.
10 o'clock the next morning.
Right.
good point. Yep. Mhm.
Again, that's programming. You can change it so you don't have that kind of secondary contact within a 24-hour period.
And it doesn't matter. It matters. It doesn't. I get a lot of pushback saying, but we are masked and outside. That's great. Doesn't matter. It's all about time and distance, that within 6 feet for 15 minutes or more, with or without a mask, inside or outside. Obviously, the risk increases when you're inside. Time and distance. Just keep that in your head.
I have a question, similar note to kind of what we started talking about of what information can we spread to our staff? We have already policy in place for, okay, what we're sending to parents, which we know would be limited information, but staff, what level are we allowed to tell them? Can we tell them specific camper names, or should we keep it very?
We try to not. Sadly, word gets out for a variety of reasons, but we try to give as much information to staff, parents, whatever, as safely as possible. You know, it's important that we need to let, you know, with the schools, we need to let a teacher know about a positive kid in the class. So if it's not a cohorted classroom, we can ask that teacher, you know, were you within, you know, were you a close contact within 6 feet for 15 minutes or more? So we're going to be really careful with that information. And I'm going to start with the nurse. And then if we need to speak to a few people, we're going to, and hope that everyone is really respectful regarding privacy. And the scarlet letter thing that I've seen this past year with adults and kids is unreal. It is very sad. I had a case last week of a 9-year-old boy who was all set to go back to school on Friday, and his friend said, "Don't come back. No one wants to play with you." So he wouldn't go back to school. So we can't have that. And kids find out because the kid's gone for 10 days. So, especially at this point in the game, they know what COVID is, and it's awful. So we have to all do a really good job. And, we can talk about that at the beginning of your programming, doing some teaching with the kids and how we're going to handle this. And we're all in this together and, blah, blah, blah. But it's really, it's shockingly sad. So let's work on that together, you guys.
Anybody else? So this will probably be the first of several meetings. As you come up with questions, send them to us. We'll get answers. We'll post the FAQ document. We'll just kind of work from here. It's going to be a process. I hope it's a happy process. I
It'll be
hope
a
it's a
great
successful process.
Yeah. It's stressful in the beginning, but once you guys get going, everyone's going to be so happy to be back at camp. I'm a rah-rah camp person, so we'll make it happen.
I do think the kids are going to be thrilled to be there. I think it's been a really hard year for kids and families. So I think kids will love being at camp. We just have to be a careful experience. Okie dokie.
This has been super helpful. Thank you so much. I really appreciate your time.
Okie dokie.
Yes, definitely.
Thanks. Bye,
Thank
everybody.
you all.